All right, welcome everyone to our COVID-19 media update for today. We have joining us Scott Bookman, COVID-19 Incident Commander for CDPHE, Heather Roth, Immunization Branch Chief, Division of Disease Control and Public Health Response for CDPHE, and we're going to go ahead and start with Scott Bookman.
Thank you, Heidi, and thank you all for joining us this morning. Dr. Rachel Herlihy is taking some needed and well-deserved time off. So I'm going to give you a quick overview of where we are with COVID cases and hospitalizations at this point in the pandemic. And really what we have to tell today is a really a good news story. Coloradans have come together and we have really worked hard to suppress this virus together. We are seeing cases go down amongst all age groups, and you can see how precipitously those cases continue to drop across the state. And so we are really hopeful about the trajectory of the COVID-19 pandemic in Colorado at this point. We can look at the next slide, which further displays how far we have come. As of today, we are down to 429 confirmed COVID-19 hospitalizations. That is 250 less than our peak in this wave, and obviously our peak in December of last year, where we were over 1,800. This is incredible evidence that the vaccine is working. It is offering protection, and it is particularly offering protection to those who are most vulnerable and those who have been hospitalized over the course of this pandemic. So really continuing to reiterate to all the importance of this safe and effective vaccine in ending this pandemic and helping us get back to normal. Next slide. I'll turn it over to Heather.
Thank you. Good morning, everyone. So along with the kind of push to get vaccine out there, I think we're all aware that there is a new incentive program, Colorado Comeback Cash promotion. So 5 lucky winners will be getting $1 million for simply getting vaccinated to protect themselves and their families against COVID. I think the big question people have is, how can I see if I'm actually in the database, if I'm in the Colorado Immunization Information System, so that I know, my name or my number is being included in the drawing. So we do have, and what you see here on the screen, we do have an online public portal that people can use to look themselves up in the system. I will say it's not a perfect portal. You have to have the data exactly match what the healthcare provider reported to the system. So these things you see on the screen here, your first name, your last name, your date of birth, and your gender, all have to match exactly what their provider reported. This includes spelling of your first name. So let's say your name is Daniel, but you go by Dan, and you type Dan in your first name, but the provider reported Daniel to us. That little mismatch will make it so that you can't find your record in the system. The other big thing I think that is tripping people up is this text and email down here on the bottom. So this portal works on 2-factor authentication. You have to tell the system something about yourself, right? Your first name, your last name, your date of birth, and gender. And then you have to tell the system about something that you own, which would be your cell phone or your email address. The big thing to know is that some providers don't report cell phone numbers or don't report email addresses. And so that data may not exist in the system. So if you're filling this form out and you select text, I want to get a text to my cell phone, your cell phone number doesn't exist on your record in SIS. That's another area where this whole thing will not allow you to find yourself in the system. The big thing I want people to understand is that just because they can't find their record using this public portal does not mean that their record doesn't exist in the system. We've heard from thousands of Coloradans who are very excited about this drawing, the chance to win $1 million, and 99% of the people that we have assisted at the department have been in the system with their COVID vaccines, and they have been included in the drawing and will be included in the next 4 drawings. So you fill this out and then you hit the search button. And if we can go to the next slide. we'll see that another piece that I think has been tripping a few people up too is this second piece where you actually have to click on this button that says request code to access immunization record. Doesn't really look like a button, but it is. You need to click that large button to have that verification code sent to either your cell phone number or your email address. And this is that second factor of authentication to make sure that the person requesting the immunization record should actually have access to the immunization record. So don't miss this step. And again, I think the big thing for everyone to know is that, you know, our healthcare providers around the state of Colorado are required to report all of the COVID doses that they administer to our system. I think by and large, our providers are doing a fantastic job of doing that. You know, we get more than 87% of the data within 72 hours of the time that vaccine is actually put in someone's arm. So I want Coloradans to feel assured that if they have gone out and done the right thing to get themselves and their families protected by getting vaccinated, that their data exists in this system and they will be included in the drawings.
All right. Well, thank you both. I know we're a quick presentation today. We want to give some time for questions. So we're on to our media Q&A portion of the update today. We'll use the raise hand function. So if you want to go ahead and use that, then what I'll do is I'll call your name, and if you could say which outlet you're with. Let's go ahead and stick to first questions first so that I can get through as many of you as possible, and then we can go to follow-up questions after that. Also, I would say if there's anything that we are unable to answer today, or you don't get a chance to ask your question, you can send that over to media_info@state.co.us, and we will help you from the media info box. And so with that, let's go ahead and start with John Frank.
Thanks for taking my question. This is for Commander Bookman. When it comes to face coverings, there's a lot of confusion about where you need them and where you don't. What are you telling business owners who are now the enforcers of these rules and regular citizens who are confused by them? Thank you.
It's a great question, and this is obviously evolving as we see vaccine rates go up and disease rates go down. We are following updated guidance from the CDC and really putting the best information we have to put forward for all Coloradans. So at this point, you know, the face covering requirements start at age 12 for those who are vaccine eligible, and we really want to ensure that you know, those who are not vaccinated continue to wear their masks in public settings. For those who are fully vaccinated, they do not need to wear a mask in most settings other than, you know, in limited healthcare environments. But we really do want to encourage all Coloradans to wear, you know, to have a mask with them at all times so that they can put it on and be respectful if they go into a business that is still requiring a mask.
Great, thank you. Meg, go to you.
Hello. I wanted to ask about this immunization portal. Last time we had heard about it, it sounded like it was further off. So is there going to be a version that's going to fix some of these bugs people have run into, or what's the situation with that?
Sure. I wouldn't call them bugs necessarily. So I think the piece that I want people to understand is that this portal, it really relies on a couple of things. Step one is what information the patient provides to the healthcare provider at the time of vaccination. So if you remember going to get your COVID shot or your flu shot annually, you know, what information do you provide to your healthcare provider at that time? Think back to that, right? Did you give them your cell phone number? Did you give them your email address? Things like that. The second piece is what the provider then does with that information supplied by the patient. And so, you know, a lot of our data comes electronically. So we have healthcare providers who are entering that patient data into their electronic health record system and then submitting that electronically for inclusion in our database. We also have a lot of healthcare providers who manually enter the data into our system as well. The pieces that I think kind of trip up in this public portal, again, are the cell phone and the email address. So as a patient, making sure that you're providing that to your healthcare provider, and as a healthcare provider, making sure that you're actually reporting that to our system. Those two pieces, I think, are essential to helping more people be able to find their own records through the public portal.
Thank you.
Great, thank you. Heidi, we'll go to you. Heidi, are you able to unmute? There
we
you
go.
go.
Can you hear me now? Sorry, this is John Daly. I think I'm on my wife's Zoom by accident, so sorry about that.
No worries. Hi, John. How are you?
Hi. So question for Scott. So Scott, looking at the big picture, what do you see down the road that could upend Colorado's trajectory on the pandemic? What worries you or keeps you up at night? Would it be the unvaccinated population? Would it be variants and their potential or some variant that could evade the vaccines? What do you see as the most potentially worrisome down the road?
Well, that's a great question. And right now things are really heading very much in the right direction, as all of our data points indicate. At this point, the continued most important thing in ending this pandemic is our vaccination rates and getting as many Coloradans vaccinated as quickly as possible. There is enough vaccine out there at this point for all Coloradans to have it. We are doing all that we can to ensure that it is accessible to people, bringing it to their neighborhoods, bringing it to community-based organizations, working with all different types of providers to ensure that this vaccine is accessible, and really starting to have conversations on an individual level to convince Coloradans who are hesitant or who are struggling to get this vaccine to help them get it done. That is the single biggest thing that we can do to end this pandemic. We will continue to evaluate what is going on with the variants. We will have more information coming out nationally about where things are headed. But right now, all of our focus needs to be on getting as many Coloradans as we can vaccinated.
And then Scott, following up, do you see a risk that we could, see, trouble or, however you want to put it, further surges down the road, let's say the fall or the winter, if we can't get that number of folks vaccinated or proportion of folks vaccinated into that higher level, which I think you and the governor and CDPHE have talked about in that 70 to 80% range?
Well, we are incredibly confident that we can get to the number that we need to get to. And the national goal has been set at 70% of adults vaccinated by July 4th. We are going to shoot as high as we can over the course of this entire summer to get as many Coloradans vaccinated as we can. And we feel really confident that we can get there.
Great, thank you. Seth, we'll go to you.
Thank you, Seth Klayman from the Gazette in Denver and Colorado Springs. Heather, can you clarify the 99% that you mentioned? Does that mean 1% of vaccinated people because of this issue haven't been entered in the drawing, or am I misunderstanding? I guess I'm confused about those proportions.
I can clarify it. So we've heard from thousands of people who have tried to find their record through the portal and haven't been able to. 99% of those people have records existing in the system. 1% don't. And most of those people fall into the category of being Colorado residents, but having received their COVID vaccine somewhere else. So you think of, our snowbirds, right, who travel somewhere else warmer during the winter and were eligible for a vaccine earlier, let's say January, February, for example, got their doses elsewhere, and then came back to Colorado for our beautiful summertime. There's no automatic exchange of data between states, between jurisdictions. So there's no magic bullet for getting that data into our system. So that 1%, we have assisted directing them to go to their healthcare provider to actually get that record put into our system so that they become eligible as well.
Okay, thanks for clarifying.
Great, thank you. Vicente.
Yes, thank you. Can you hear me okay? I'm sitting in a noisy environment. Can you hear me okay?
Yes, we can.
Okay, thank you. I'm getting a flat fix. Sorry about that. Do you guys think the problems people have seen when it comes collecting vaccine data for the lottery is adding to their hesitancy to get the vaccine in the first place? The reason I'm asking that question is because a lot of people were hesitant in the first place. And some now may be shaking their heads because they're saying, well, if I go get the vaccine, it's not going to show up in the lottery anyway, so I'm still not going to get it. Are the problems adding to perhaps more hesitancy? Thank you.
I guess that's for me, huh, Scott? I don't think so. Again, I think we know that we had over 2.9 million Coloradans who were put in yesterday's drawing. And what we know about the number of doses that have been given across the state, we feel that that was really representative of the truth in terms of how many people have actually been vaccinated in the state. I don't really think that, not being able to necessarily find yourself in the portal would create more hesitancy. I do want to add, though, speaking about the portal, that people should try various combinations, right? So if they have a legal name that can have a nickname, they should search both of those options. If they were unmarried at one time and they may have their maiden name in the system, they should search that way. So try various options before totally despairing and giving up. But then also just remember that our providers have done a really fantastic job of getting data into the system. They are following rules, they are following requirements, and they're reporting this data to us.
Great, thank you. Chris, we'll go to you.
Chris Vanderveen with 9 News. Thanks for taking the question. Scott, my question is for you. We have roughly, you said about 429 people who are hospitalized with COVID right now. That number's been going down. Do we know how many of those 429 have been vaccinated or have not been vaccinated? And if we don't, or if the state is not collecting that data, why not?
Thanks, Chris. We will need to get the specifics back to you. So Heidi and the team will work on getting that information. We do collect vaccine breakthrough information. We're obviously monitoring that very carefully. Vaccine breakthrough cases are exceedingly rare. And from what we've seen, hospitalized vaccine breakthroughs are even more rare. But we'll get you those details.
Yeah, Chris, we can follow up with you. Megan Hiller, we're going to go to you.
Hi, Megan with KKTV in Colorado Springs. I just had a quick question here. There are some people who I feel like won't get vaccinated no matter if they're going to be entered in a lottery system or anything. I mean, how do we get to the number to get to that herd immunity if there's just some people who are so set in their ways not wanting to get vaccinated?
All right. Well, I didn't see Heather jumping off to answer that one, and so I will try to give the best answer. And we are going to do all that we can. This is a multimodal, multi-pronged approach to make sure that we get as many Coloradans vaccinated as possible. We don't actually know what the number for herd immunity is in any particular population at this point. That nationally, internationally, we continue to try to understand what that is. But we are going to do all that we can to make this vaccine accessible, to provide the best information that we can to all Coloradans, and really, like I said, work one-on-one with people who are hesitant to see what we can do to get them where they need to be to get this safe and effective vaccine.
Great, thank you.
If I could, I would just add, the number and the percentage of true, vaccine refusers, even in Colorado, where we have kind of a liberal leaning in terms of vaccine acceptance, is pretty small. So our efforts are really focused on this middle ground, right? These people who have concerns and are hesitant about the vaccine, but can be convinced by people they trust, including their healthcare providers. So one thing we are doing is partnering with primary healthcare providers, giving them the tools and resources to have these conversations, these one-on-one conversations with patients who they have questions, and they have valid questions, and they just need some answers to make an informed decision.
Great. Okay, I think I'm going to go ahead and go to Erin because you haven't asked a first question yet. So let's go. Erin O'Toole.
Okay, thank you. Hi, Erin O'Toole, KUNC in Northern Colorado. My question is about the comeback cash. I know other states that did $1 million drawings, like Ohio, they were talking about huge increases in the number of people getting vaccinated in response, double-digit increases in some cases. I'm just wondering if you have tracked any of the numbers in Colorado since the drawing was first announced, and are you seeing anything similar here? Thank you.
Yeah, I think the governor actually shared a slide yesterday during his presser that had a kind of a daily breakdown of doses administered. We saw a little bump after the announcement, and then kind of held steady. And then we ran into the Memorial Day weekend. So I think the timing of the announcement being quickly followed by a long weekend probably had an impact on the data. I'll also say that the data has a little bit of a lag too. So I don't think we'll know the true impact for a little while, but it is something that we're monitoring.
Great. Okay, I think we might have time for maybe one more. John, I'll go ahead and go to your follow-up.
Wonderful, thank you. First of all, I would love to get those numbers on the breakthrough cases that Chris asked about as well. And I have my second question is also about numbers. You've talked about hearing from thousands of people. Do you have a more precise number on how many calls that you've received or emails, inquiries from people not sure they're in the database? And then what percentage do you think are not included in there at this point? I know you've done some work over the last week to try to improve that number. So what percentage of people who've received their vaccines do you think are not in that database currently? Thank you.
Sure. I don't have the number off the top of my, right here by me, but we can get that for you. We have been tracking the number of calls and the number of emails that our large team has been responding to. So I can get that number. In terms of percentage, not included, I don't think we really know that either, but I do know and can say that we have done a lot of work in terms of making sure that our VA members in Colorado have been included. Their data does not exist in the system. And we are still working on getting a solution in place for DoD. Their data does not exist in the system. So again, probably a smaller percentage of Colorado's population, but and not a number that I have off the top of my head.
Great. I think we have time
If you
for
follow up, that'd be great. I appreciate it.
Yeah. I think we have time for one more. So Meg, I'm going to take you as our last question.
Thank you. You had talked about doing this multi-pronged approach and relying more on primary care providers, people that are already trusted on these issues. How does that shift the kind of the bigger approach? Because my understanding would be like a primary care provider wouldn't necessarily be able to use 11 doses any given day before they have to throw the vial out.
Yeah, I can take that one too. So, and this is happening nationally, right? Where we're shifting from large community vaccination sites where you've got, 11 people lined up in front of you and you're going, through the line to these more, intimate settings where you're meeting with your primary healthcare provider. CDC has also kind of noticed this shift and provided, I think, some really great guidance around acceptable wastage. So we anticipate, wastage increasing a little bit here. And really the goal is to not miss an opportunity. So if you have someone, especially someone who may be hesitant, that is coming into your office, having a conversation and then deciding to get the COVID vaccine, and it means that you're going to, puncture a vial and not necessarily have, the number of people you need lined up to get through that vial within, the 6 to 12 hours. It's okay. That's one more person that's going to be protected from severe illness and poor outcomes. So we've supported that, and we've shared that guidance with healthcare providers across the state who are enrolled in our program of all sizes, that don't miss an opportunity to vaccinate if you have people in front of you who want the vaccine.
Great. And so with that, thank you for joining us today for our COVID-19 update. Again, I'd like to thank Scott and Heather, as well as our interpreters. And if we did not get to your question, or if you think of a question later in the day, please go ahead and send those to media_info@state.co.us. And I hope you have a great rest of your day. Thank you, everyone.